All hospitals, all healthcare across the nation are short-staffed. PAs fill a need.
Anybody wanting to go into healthcare as a primary field, but also those that are looking to go into healthcare as a secondary career choice.
I think the ideal candidate is somebody that wants to have a great connection with patients, that wants to have the ability to have a family life outside of their medical career.
I think what makes the PA profession unique as a profession is that upon graduation and working, the physician assistant is able to change specialties on the fly. There's not a separate reboard, there's not a residency requirement, and so that ability to adjust the clinical practice, I think, opens up many doors.
I have got to do so much in my career, and it's been so fun, and it's made me a lifelong learner. Each time I come into a different career and I explore something new, I become a better PA.
This area is so underserved. The amount of interest from the clinical world here for our grads is incredibly high.
PAs are in such a high demand. It is just amazing. You look at the list of the opportunities out there. Whatever you want to do, the sky's the limit.
The national average right now is around $85,000 starting yearly salary with no experience coming out. And then of course it moves up from there depending on specialty and region that you work in.
Today, PAs are utilized the way they're supposed to, really expanding that physician's role, being able to be an independent provider with a backup system of having the physician there in case there's any kind of need.
Being able to perform 85% on average of what a physician does means that I can help the physician better manage their time to be with the patients that more need their care.
You're working as a team member with a physician. You still get to do a lot of the things that the physicians do. The training is at the level of a physician.
One of the unique things about this program is we have a little bit different focus. Certainly we know that grades matter. You have to be able to do the work. But our program really is focusing on what a lot of people might call the soft side of medicine. And that's the communication, the empathy, because what makes a good healthcare provider is the ability to communicate, the ability to earn the trust of the person who's giving you the access to the most important thing in the world, which is their loved ones.
We get to teach them what we want as providers, so it's extremely exciting to have this. Evansville's been waiting around for this program since I started 19 years ago, and it's exciting to have this program in an environment that really needs more healthcare providers.
It's a 28-month program that is year-round, and what the med school model is to have all didactic classes, and there's some early exposures there, and then the last year is all clinical. And so that will be one-on-one with preceptor, which is mainly physicians and maybe other PAs or other healthcare providers, in a one-on-one relationship to give about 2,000 plus hours of clinical time in a variety of specialties. With the PA programs, you have to have a degree. So it is a pure graduate program. Now, what's interesting about our program is we do not require a specific degree. It can be any degree out there. We just have about 40 hours of prerequisite courses. Now, on those prerequisite courses, they're pretty standard for a pre-med curriculum. So at the University of Evansville, with their physician assistant program, there are two pathways to gain entry into our program. The standard pathway is for graduate students. They complete a common application known as CASPA. From there, as with other programs, they have to complete the GRE, certain prerequisites, and then apply and go through an interview process. However, we also offer a second pathway that they can actually enter as an incoming freshman. The second pathway for entry into the physician assistant program is actually unique to the University of Evansville. This is a direct entry pathway known as the Baccalaureate to Physician Assistant Program, or BPA program. During this program, a high school senior or incoming freshman will apply for this position, will interview, and given acceptance will be granted a provisional seat upon graduation from the University of Evansville. And I think one of the things that makes this special is you have an age diversity, but you also have an experience diversity. We have foreign medical graduates, we have doctorate degrees, all the way to no experience whatsoever in the clinical world. We're partnering with the IU School of Medicine Evansville campus, and we'll be moving to the new facility downtown. In that center, besides the PA program, we'll have the med school there, we'll have the physical therapy program, we'll have an occupational therapy program, and accelerated nursing. Now the goal then is to get all these different professions and learners together as much as possible to learn from, with, and about each other. We have an all-star faculty that would rival any in the nation right now.
You have to understand that this faculty has been handpicked to really provide a great education for the students.
Your professors do know you, and if you ever think that that's a disadvantage, it's not. It's because we all care about you. We all want you to succeed.
And we want those providers that come out and people go, I want to see that provider. I want that to be my provider. We want our preceptors to come back and say, give me another UV student because they were phenomenal.